Welcome to this briefing session on the Request for Proposal 177 Youth Enhanced Services. This program is being commissioned by the Hunter New England Central Coast Primary Health Network with funding from the Department of Health, Disability and Ageing. In the spirit of reconciliation, I acknowledge the traditional custodians of country throughout Australia and their connections to land, sea and community. I would like to acknowledge and pay my respects to the Darkinjung people, the traditional custodians of the land on which I am meeting from today. I'd like to extend those same respects to the elders past, present, and recognise the continuing connection and contribution to this land. Aboriginal culture is heard through our ears, kept in our minds, and held in our hearts forever. Today's presentation will take you through some of the key aspects of RFP 177 Youth Enhanced Services and the Request for Proposal process. If you have any questions following this presentation, please lodge these via Tenderlink. Responses to all questions will be issued via an addendum. To support probity and fair competition of the commissioning process, today's presentation will be read from a script. In accordance with the probity principles which cover these commissioning arrangements, respondents should make their own independent assessments and investigations and obtain their own legal, business, and other professional advice on the request for proposal and its associated requirements. This information session is being held for the purposes of providing background information only. Potential respondents should not rely on statements made at a briefing session as variations or additions to the official RFP documentation, unless it is later confirmed in an addendum. We will cover the addendum process later in the presentation, but please note that organisations who have registered their interest through Tenderlink will automatically receive addendum notifications. To support transparency and open competition during this request for proposal process, respondents should be aware of the protocols that have been established to minimise the risk of any improper practice occurring that could influence the fair operation of the market or the probity of the tender process. During the procurement exercise, PHN staff will continue to interact with respondents as part of any business as usual functions. However, during these interactions, the only information that can be provided about the procurement exercise process will be limited to information that is already available to all respondents. Respondents must not seek to elicit or obtain from any PHN staff information concerning the process that is not already available to all respondents. Respondents must not seek help to develop their response from any person in a position that could be perceived as having power to influence the process or the results. This includes current employees and board members of any of the PHN represented on the working group. About Hunter New England Central Coast Primary Health Network. With a vision for healthy people and healthy communities, the PHN is a not-for-profit organisation funded by the Australian Government. We work with healthcare providers across the Hunter, New England and Central Coast regions to commission innovative programs and services designed to improve the efficiency and quality of the primary health care for greater coordination, better systems, and improved access to healthcare, creating a positive impact in our communities. We are working to our purpose of increasing equity of access to primary care services. The PHN receives funds and commissions for services to be provided. The PHN strategic plan has priority areas relating to mental health, First Nations health, population health, health workforce, digital health, aged care, and alcohol and other drugs. The request for proposal is a result of government funding addressing the needs of young people aged 12 to 25 who experience severe and complex mental ill health. Financial and non-financial costs and benefits are considered as part of our evaluation of tenders to ensure effective and efficient use of the resources available. To ensure the PHN is achieving value for money processes are maintained to ensure competitive but non-discriminatory practices. Services should not duplicate existing services in a local region, and decisions are made in a fair and transparent manner. It should be noted that price is not the sole determining factor in assessing value for money related to this exercise, and processes will align with the scale and scope of the exercise. The value for money framework reviews four main areas: economy, assists to consider the cost of the program for the quality, such as spending sustainably; efficiency, increasing the usefulness of program outputs in relation to the cost of program inputs, such as spending well, for example, ensuring no duplication; effectiveness, enhancing the achievement of program outcomes in relation to the cost of program inputs, such as spending wisely; equity, understanding the differences in how impacts and outcomes are experienced by different population groups due to social inequities, ensuring program benefits are distributed fairly among the population, such as spending fairly. By implementing this framework, we can ensure that the health outcomes we aim to achieve are aligned with global best practices, public expectations, and the responsible use of resources. The value for money framework provides transparency and accountability in our decision-making process. Hunter New England Central Coast Primary Health Network is responsible for leading mental health and suicide prevention planning, commissioning, and service integration at a regional level to improve outcomes for people with or at risk of mental illness and/or suicide. HNECC commissioned Youth Complex Mental Health Services in 2018. The service was designed to deliver clinical care and support to young people experiencing or at risk of developing severe mental illness. This included young people who had self-harmed, attempted suicide, or have suicidal ideation, and/or belong to a priority group, including those who are First Nations, identify as LGBTQIA+, or are disengaged from education. The service aimed to deliver improvements in the young person's mental health, well-being, and other presenting issues that may impact their health. The programs are currently delivered by 4 service providers across the Hunter New England Central Coast region. These are Central Coast, New England Northwest, Newcastle Surrounds, Lake Macquarie, Raymond Terrace, and Port Stephens, and the Hunter, Upper Hunter, and Mid Coast. An evaluation of the Youth Complex Mental Health Services was undertaken on behalf of HNECC PHN between April and August 2024. The evaluation made findings in relation to population health and well-being, provider, staff, and clinician satisfaction, consumer experience, effectiveness and efficiency of services, and health equity. After the completion of the Youth Complex Mental Health Services evaluation in August 2024, HNECC PHN began the process of planning a collaborative consultation and design process to support the implementation of key recommendations from the evaluation. The PHN is inviting respondents to submit proposals to support the transition to a refreshed and more responsive service model, Youth Enhanced Services. This invitation reflects our commitment to co-design, evidence-enforced planning, and sector-wide collaboration to better meet the complex mental health needs of young people across our region. The consultation process built on the evaluation of youth complex mental health services identified key opportunities to strengthen service delivery. The evaluation consulted with stakeholders with lived experience, as well as clinical stakeholders, surveying young people accessing the service, surveying provider staff, focus groups with provider staff, individual and small group interviews with local health districts, providers, Origin, and PHN staff. The evaluation was then followed by a collaborative consultation with a variety of key stakeholders invited to attend. It resulted in 31 participants from across the sector, including youth complex mental health service providers, primary mental health services, local health districts, Department of Education, and Department of Community and Justice. These consultations helped refine and prioritise recommendations from the evaluation. By engaging key youth mental health stakeholders in the process, the PHN aimed to ensure that future services were aligned with sector insights, community needs, best practice approaches, and are more integrated, adaptive, and impactful for young people experiencing complex mental health challenges. The PHN invites suitably qualified and experienced organisations to provide primary care mental health support to young people aged 12 to 25 years experiencing severe and complex mental ill health and can deliver youth enhanced services to either one, two, or all three of the following regions: Central Coast, the Hunter and Mid Coast, and New England. Youth enhanced services aim to improve equitable access and care pathways for young people aged 12 to 25 who are experiencing or at risk of developing severe and complex mental ill health in the Hunter New England Central Coast PHN region. Youth enhanced services will ensure each young person receives the right clinical care and support at the right time, resulting in measurable improvements in mental health, well-being, and related social outcomes. The aims will be achieved by providers delivering timely, high-quality, evidence-based and collaborative clinical support, providing youth-friendly and culturally safe services for all eligible young people, including those who have self-harmed, attempted suicide, or have suicidal ideation, who are able to be appropriately managed in primary care, are experiencing personality disorders, eating disorders, substance use, early psychosis, trauma, or neurodivergence, are First Nations, LGBTQIA+, culturally and linguistically diverse, living in rural and remote areas, homeless, disengaged from education, or affected by domestic, family, and sexual violence, as well as other vulnerable cohorts, as well as ensuring services are culturally safe for First Nations young people. Youth enhanced services support young people with or at risk of mental health diagnosis being managed within the primary care sector who present with complex treatment needs or impairment. The PHN seeks proposals to deliver comprehensive, responsive, and culturally safe mental health services for young people aged 12 to 25 years experiencing or at risk of developing severe and complex mental ill health. The Youth Enhanced Service Model provides timely, equitable, and evidence-informed care through a flexible and integrated approach. Core components of the Youth Enhanced Service Model are enhanced access, flexible delivery, including outreach, telehealth, and place-based options, evidence-based psychological interventions, appropriate therapeutic approaches consistent with clinical guidelines, case management, addresses practical barriers impacting mental health and coordinate care with other services, access to specialist medical care, facilitates oversight and management of complex mental health conditions, partnership and integration, collaborate and build relationships with local health, education, and community services to provide comprehensive and seamless care. The service scope and target cohorts. So services must be tailored to meet the needs of young people presenting with complex mental health concerns, including but not limited to trauma, major depression, severe anxiety, personality disorders, eating disorders, substance use, early psychosis, and domestic family sexual violence. The service objectives include to provide timely access to appropriate evidence-based care, to establish clear referral and transition pathways, to complement, not duplicate, existing programs, to achieve measurable improvements in mental health and wellbeing outcomes for young people. Out-of-scope parameters for youth enhanced services are duplication of existing services, young people outside of the approved local government areas, and young people whose needs can be managed by lower intensity services. Evaluation of the submissions will be undertaken using the criteria listed on screen. Please ensure that your submission adheres to the allocated word limit or templates provided. The PHN cannot accept submissions that are not provided via Tenderlink. Key dates are listed on the slide. The closing time and date is 10 a.m. Australian Eastern Daylight Time, 25th of November 2025. The Tenderlink forum will close on the 18th of November 2025. A short list of preferred applicants will be created based on the evaluation process. It is expected that the notification of outcomes will be announced by mid-March 2026. Following this, successful and unsuccessful respondents will be notified. A communication protocol has been developed for this exercise. The purpose of the protocol is to establish procedures to minimize the risk of any improper practice occurring that could influence the fair operation of the market or the probity of the process. The following principles will guide the primary health network in communicating with respondents. No respondents will receive any information in advance of it being made available to all respondents, and no respondents will receive any information that is available to all respondents. All information related to this exercise will be available on the TenderLink website via published addendums, including this presentation and script. You should keep track of the online forum, which is where questions and answers will be posted. Your tender response must be lodged through the TenderLink website. A helpline and email address is available if you experience technical difficulties using the TenderLink website. That concludes the information session. If you have any questions, please provide in writing through the online forum icon on the TenderLink website. Questions and answers will be scribed and published as an addendum accessible to all registered organisations. Thank you for your time today.